Now, medical experts are warning it's quite likely there are already UK-based cases of the new Mpox strain that's causing concern amongst global health officials. The new, more transmissible strain has caused nearly 600 deaths in Africa, but elsewhere, only Sweden and Pakistan have so far confirmed cases. Medicine's Professor Paul Hunter says the complexity of testing means it is still hard to tell the true scale in the UK.
When somebody gets an infection, it can take several days before they develop the classic appearance that would make people think, oh, this is monkeypox. To confirm that, they would need to do a test and sample, typically sampling the blister fluid. That would then go to the laboratory that would then run genetic tests to show whether or not it was monkeypox. But then to know that it was the 1B variant out of Congo, you'd need to do further sequencing.
Our correspondent Emma Birchley joins me now. The professor called it monkeypox there. It's been renamed Mpox to remove some of the stigma. But even so, there are concerns about this new strain, and it's likely here already.
Yes, and it's particularly contagious. It's been given the name Clade 1B, first emerged in the Democratic Republic of Congo and has rapidly spread, particularly in the east of that country, but it's also gone to 16 other African countries, 17,000 cases in all, and as you said, close to 600 people have died. Now, the World Health Organization has described it as a global emergency, which needs a coordinated global response, and that also means making sure that we don't hog vaccines and tests, that those do head to Africa where they're needed. Here in the UK, overall the risk is seen as low, and as we were hearing there, it's not yet known if there are cases here, but the planning is underway. So that means making sure that clinicians know what to look out for, that the rapid testing is available, and that protocols are developed to prevent transmission as far as is possible. It can be passed on through sexual contact, but also through cuddling, kissing, holding hands, so that makes it really tricky. And the kind of symptoms are also difficult to spot because they're just like flu-like symptoms in many cases: aching body, swollen glands, headaches, but also those horrible lesions we're seeing. Particularly, we've seen the pictures, haven't we, on people's hands. Now, here in the UK, we have seen cases before, and before spring of 2022, it was mainly from people who travelled to Africa. Then from May 22, actually was being transmitted in the UK, particularly between gay and bisexual men. There was a vaccination programme to deal with that. Over 3,000 cases up to the end of that year. Since then, it's really dropped back. But now everyone on the lookout to see what the situation is likely to be here as those tests take place.
Emma, thank you.